Hello, welcome to Ask the Doc. My name is Jody Archer. Today we're here with Dr. John Brinkman, and we're discussing tonsillectomies. Dr. Brinkman is one of our otolaryngologists here at King's Daughters, also known as ear, nose, and throat specialist. Dr. Brinkman has been seeing patients in Ashland for 13 years now. He also sees patients in Portsmouth and performs surgeries at both of our facilities. So Dr. Brinkman, today our topic is tonsillectomies. So can you give us some of the indications for tonsillectomies?
Yes. Some of the there are two avenues for indications for tonsillectomy. One is the infectious route and one is the obstructive sleep apnea route. The infectious route, really, we follow how many infections you've had over the course of a certain amount of time. The classic is if a child's been treated more than about 6 times over the course of a 12-month period with antibiotics for strep throat, then that's an indication to remove their tonsils and adenoid. This indication also extrapolates down some if they've had multiple infections over the course of several years. In other words, 3-4 infections each year for 2, 3, 4 years. This also is an indication. If children have specific complications from these infections, for example, scarlet fever, rheumatic fever, these type of things, just add to the indications as minor, but still there. The obstructive sleep apnea aspect of indications are parents bring their children in and they complain that their child is not sleeping well at night. They have severe snoring and are gasping for air, waking themselves up frequently through the night. And this is obstructive sleep apnea. Some of the symptoms that I talk to some of the parents about that they don't think about, things such as difficulty concentrating in school. Some kids are treated with ADHD medicines. Bedwetting is another one that parents really don't put together with obstructive sleep apnea, but one of the more common symptoms. Morning headaches, these type things. Either way, when the parents come in with these type of indications, we suggest tonsil and adenoid.
Okay. We talked a lot about kids, but do you perform the surgery on adults as well?
Absolutely. All age ranges. There's no limit. The lower, we rarely do children under about 2 years old. 2 to 3, it would be pretty young. The most, statistically speaking, the perfect age to have your child's tonsils out is age 4. And that takes into consideration pain control and parents getting back to work and use of narcotics. But yes, we take tonsils out of everyone.
Okay. Can you explain the procedure?
So tonsillectomy with adenoidectomy is an outpatient procedure. You come to the hospital, typically for children. There are no shots or needles or blood work or IVs initially. The child is given some oral Versed, which kind of mellows them out a little bit. We roll to the operating room where they receive a mask anesthesia and with just gas to knock them out. And once they're completely asleep, we get the IVs and that kind of stuff, the stuff we need for surgery. As far as the procedure, we use a coblation device to remove their tonsils and adenoid. It takes about 5 minutes to do this, and for 99% of the children, we wake them up and ship them home. There's a small subset of very young or any other medical history that we may have to keep them overnight, but that's usually the extent of it.
Okay. And what's the general recovery time for tonsillectomy?
So typically after a tonsillectomy with adenoidectomy, we will see the children back in about 10 days post-op. By that time, they're feeling mostly better. Those first 7 days are painful. And we do give them medicines to help control this. But in the end, it's going to be a 7 to 10 day recovery. We also talk about with parents that one of the biggest risks of the procedure is bleeding. And bleeding occurs only about 5 to 6% of the time after we take out tonsils. So it's not very common. If it happens, it's typically not the first week after surgery, it's the second week. So between days 6 and 14 is when that's going to happen. So we tell parents to try to keep their children relatively calm for about 2 weeks.
Which is sometimes hard.
It is.
Do you need a referral to see if
Absolutely not. We do not require a referral. It would be not on our ends. I would assume some insurances require that, but not our office.
Okay, great. Thank you, Dr. Brinkman. Dr. Brinkman sees patients in both Ashland and in Portsmouth. He performs surgeries at both locations as well. If you have any questions, you can call his office at 606-408-8100, or you can visit our website at kingsdaughtershealth.com.